Thank you so much, Kristen. Well, let's get started. First, let me say thank you for joining today. We appreciate your time. We've been having these calls throughout Wilson County just to provide kind of an update of what's happening in our community and to ask for your preparation. And so first, let me acknowledge my team. I've got a couple people on the line with me today. My name is Jay Hinesley. I'm the president of Vanderbilt Wilson County Hospital. We also have with us Dr. David Aronoff, Director of the Division of Infectious Disease at VMC, who's been advising us and providing support today and throughout the pandemic. I also have on the line Tracy Pope, Director of Community Relations here at Vanderbilt Wilson County, as well as my Chief Medical Officer, Dr. Adam Huggins. We've got a pretty brief agenda today, but I'm going to jump right in if that's okay. And I'm going to share my screen because I'd like to share some data with you. And if I could get Kristen to disable the function that allows me to share the screen, that would be great. I think there's a button you're going to have to push to let me do that.
And if everyone who's not speaking can mute their screen, that would be great.
Yeah, Kristen, it's sharing your screen, but you're going to have to enable it to allow me to share mine. While she's doing that, really two goals for today. I'd like for you to listen and learn exactly what's happening today. And so there's two asks I have of you today. The first is to educate your family, your friends, and your employees about what's happening. And the second is to enforce the masking mandate and the social distancing guidelines that have been put in place. And I'm going to take a minute to try to show you what's happening and why that's important. Let's see if I can share the screen. Here we go. And then we'll open it up for questions and comments then. So I'm going to share my screen here and walk through a little bit. Did y'all see my screen? Greg? Okay. Well, this is probably not news to you, but let me just share with you kind of what's been happening. Over the last year, you can see this is Wilson County. I've got pulled up from the Tennessee Department of Health. This is Wilson County's reported cases across the state for new cases by day. And what we're seeing here is back in April and May, you know, we had most of the country was shutting down and was working hard to prevent the spread of this virus. And you can see that right about July 4th, we had a bit of a spike after July 4th. We had a reduction there shortly after. And then since October, this is the part that I want to point out to you because this is the part that has us most alarmed. Since October, our cases have gone up successively every day until we find ourselves in today. As of yesterday, 11/22, the 7-day average for our county, let me go down to Wilson County here since it's updated. Our county looks very similar, the graph. And our county has now reached a point on 11/22, our 7-day average is 108. And the reason I point that out to you, because if we look back here at our highest previous peak, we had a 7-day average of 59. And for a hospital, what that means is that during that time, the summer months are typically our lowest volume months. We have lower cases of other illnesses, and we were able to accommodate across Middle Tennessee and the state. We were able to accommodate more effectively the volume that came through COVID-19. If you flash forward to today, we've been on this concerning trend now since the beginning of November, and there really doesn't appear to be an end in sight yet. And this is a concerning trend for us because not only do we have additional COVID volume, but we also have the other patients that we anticipate this time of year. And I'm having this call and these calls throughout the community because it is a very concerning trend. It's a very concerning trend, and we would like for our community to take this seriously. And the reason we need to take it seriously is because we have to make sure that we can continue to take care of you and your family. And we are making plans. We have additional capacity built into our system, but there are obviously limits to that ability. And we want to make sure we do everything we can to make that possible. I'm going to move over now to the state hospitalization numbers. Again, I don't think there's any surprise here based on what I just showed you, that with every new case, the potential for hospitalizations goes up. You can see that back in October, As a state, we had about 1,000 hospitalizations. You come to today, and we now have over 2,000 cases, and we've set a record for hospitalizations every day this month, and that continues to go up. So I'm going to stop there because I want to reflect for a second. This is real. It is happening. It is happening across the United States, and it is certainly happening in our community and across Middle Tennessee. And I'm going to go back to what I said earlier. The primary function of this call today is to ask two things of you. The first is to ask you to enforce the masking mandate that's been put in place by Mayor Hutto for Wilson County. And trust me when I say I understand how controversial that statement can be. And I want to be real clear. This is not about Republican, Democrat politics. This is about taking care of our community. And the mask is the most effective way at limiting the spread of this virus. And so we're asking you to take it seriously and to enforce those guidelines to put in place. And then secondly, again, enforcing the social distancing guidelines. So let me back up. Educate yourself and your employees in your community, and then enforce the guidelines that have been put in place to protect your community, because we have concerns. We have real concerns. So I'm going to stop for a moment. We are fortunate we have Dr. Aronoff on the line from VMC. I want to give him a moment just to add some color commentary to what I've said so far. Dr. Aronoff?
Yeah, thank you very much, Jay, and hello to everybody. It really is an honor to be able to join you on behalf of Vanderbilt University Medical Center. And just to echo exactly what you just heard, which is this pandemic right now is really active all over the United States, and in particular in Tennessee. We've learned a tremendous amount about what we can do to slow the spread, to flatten the curves that you just looked at. We're close to having vaccines available, but we're not there. And it probably will be into 2021 before we have vaccines that really are going to reach the general public. And so between now and then, it really is important to try to step in front of this pandemic and slow it down. And the ways we do that are keeping distance between one another. This virus primarily spreads from person to person through our breath. And the most, I think, nefarious part of this pandemic is that it is largely being spread silently by people who feel well, they look well, they have no concept that they're contagious or infectious, but they are, and they're spreading it to other people. We know that somewhere between 1 out of every 5 people who gets infected and 2 out of every 5 people who gets infected never have symptoms at all. But they can be contagious. We also know that for the rest of people who get infected with the SARS-CoV-2 virus, that they do indeed get symptoms, but they spend a day or two before they're having symptoms shedding a lot of virus in a pre-symptomatic period. And so that pre-symptomatic group and the people who never develop symptoms are really responsible for a lot of this pandemic spread. And because we can't just look at someone and know that they're infected or not, or even look ourselves in the mirror and know that we're infected or not, we really need to each be playing our part. We need to be playing our roles here. And that boils down to being very aware of our surroundings, keeping distance as maximal as we can between people, working to make sure that our facilities are as best filtered and ventilated as they can be, and enforcing the mask mandate. It's very clear now, as this pandemic has worn on, that places that put mask mandates in place, even given the fact that not everybody obeys a mask mandate, but just having that in place and having more people than fewer people engaging in that behavior is associated with lower rates of increase of cases, lower rates of hospitalization, which are critically important for us right now, and lower amounts of death. And in fact, research across Tennessee has shown those things. So I'm here to just thank you all for your leadership. Thank you for understanding. And also, I'll be available for questions. Jay, I'll turn it back over to you.
Thank you, sir. Dr. Huggins, anything you'd like to add?
Yeah, Jay, thank you so much for inviting me to this, and then thank you to everybody that's joined us for taking a little bit of time out of your day. I think I've met some of you, but certainly not all of you. I'm Adam Huggins. I'm the Chief Medical Officer here at Wilson County Hospital. It's been a privilege to be here, although this has been obviously a very interesting time that I think none of us really expected. I think another reason that we're really reaching out to everybody, and I thank Jay for being so proactive about it, is based on experience. We know that after Memorial Day and after the July 4th holiday that we saw bumps in our patients being infected and bumps in our hospitalization. And I think our concern is that, particularly with the Thanksgiving holiday, Christmas holiday, New Year's holiday coming up, that we are going to see, even more bumps on top of our already, stressed system. And so this is where it really is. All of you on this call right now are leaders in the community and are all well respected and have your own networks of people. And I think if we lead by example and lead together, we can really help save this community a lot of potential pain or sickness. I can't speak for everybody on this call, but I know certainly here in the hospital, we've had people that are close to us that have had family members that have gotten sick, and some of them have even died from COVID-19. And it's a really terrible thing to have to go through, and we certainly don't want people to experience that ever, particularly not during the holiday season. So this is the first time in my life I've ever been faced with anything like this, and hopefully the last time, but this is something where we can't do this alone as the hospital. We really need the members of the community to really help. And so we look to the leaders in the community like yourselves to help. So anything you can do to help encourage that among your circle would be greatly appreciated, because we know it will ultimately help save lives.
Thank you, Dr. Huggins. Couple other key thoughts before we stop and ask for questions. I want to reflect that the health systems across Tennessee and Middle Tennessee are unified in this. We're all seeing the impacts, and we are all concerned about the trend. And we would like to ask for your support. I also want to direct you to one of the things that I didn't do earlier. I want to direct you to the CDC's website. I've got it pulled up here. The CDC is a great location. Their website has a great location for information on how to protect you, your family, as well as your business. Recognizing that this is a chamber, you have to stay in business. But we ask them that you do this in a safe manner. And the CDC is a great website and resource for how to conduct business while also following the guidelines that have been put in place. I'm going to stop. I'm anticipating several questions. I'd like to just pause there. It's going to take a minute for folks to unmute your lines, and we'll just pause for a second.
Jay, this is Greg Butler. I do have a question, and Dr. Huggins spoke to it briefly. Thankfully, or maybe not so much, my family has no plans to visit us for Christmas. I mean, for Thanksgiving, but they do have plans for Christmas. And most of the warnings we hear out currently on the TV and other places are, no Thanksgiving travelers to your house, or something similar to that. I would presume that the guidance that holds for Thanksgiving in terms of limiting travel, limiting households of getting together if there are large numbers, will hold forth for Christmas and New Year's as well. Although I'm not hearing about that. That would help me kind of have some teeth into what we may be made to do with our children's families, and have them stay at home this year. So I guess the question is, does that guidance for Thanksgiving follow through, for the foreseeable future?
Dr. Aronoff, do you want to take that one?
Yeah, thank you very much for that question, Greg. Things can certainly change between now and the end of the year, Christmas, New Year's period of time. If we look back to when we had the peak in July, that sort of disease activity came down to a low really around September. What that taught us is that by doing the things that we need to do in the absence of a vaccine, we could go from that peak to a more reasonable lower level that got us thinking more about opening schools. But that took over a month. That took, somewhere between 6 weeks and 2 months to really come down. And so first of all, what we need to see is what Jay showed us, that increasing amount of disease activity has to actually crest and start to come down to a level that seems to be safe enough that that we can be thinking about getting back together. Right now, it's hard to know exactly when that would be. I think this time in December, we're still going to be having a lot of disease activity. We're still not going to have a vaccine widely available. And so I do think we need to be prepared as if this holiday season is going to be really disrupted because of the COVID-19 pandemic. Obviously, and unfortunately, things could get worse. So we definitely need to and want to do everything we can in our powers to improve the situation. Regardless of what we decide or recommend, people are going to get together around the holidays, and we need to be able to advise them to, isolate for 2 weeks before you get together to minimize the risk that you bring a virus home into the family situation around the holidays. Consider getting tested beforehand. But all of those things, while they may reduce risk, they don't eliminate it. And that's particularly harder to eliminate or reduce when disease activity in the community is so high.
Dr. Aronoff, we have one question regarding asymptomatic testing and whether or not folks, if they feel like they've been exposed or need to be tested, what the guidelines are around asymptomatic testing, and if that's important to take the test, or is it taking up unnecessary resources?
Yeah, thank you for that question. So for sure, if somebody is a close contact of a case, it is a good idea to get tested when you feel no symptoms. If you do develop symptoms, absolutely should also get tested. Remember that from the moment someone gets infected to the time symptoms begin, if they're going to get symptoms, on average takes about 5 days, but can take as long as 2 weeks. And that's why we ask people to quarantine for 2 weeks after they've been exposed. Testing is a little bit tricky. The reason we advise people to get tested once they are a close contact is to see if we can document that they are positive. Because if their test comes back positive, they're no longer a close contact. They're now a case. And that's important for now their contacts. So we recommend that people go to get tested somewhere between 5 days and 10 days after that contact. In that window, assuming someone's not having symptoms, in that window of time, 5 to 10 days after exposure, is when the risk that their test would be falsely negative is at its lowest. So what I mean by that is if I get infected today and you test me today, my test will 100% likely be negative because I haven't started making enough virus to make the test be positive. Tomorrow, 1 day after exposure, even if I actually got infected, the risk that my test would be negative incorrectly is about 80% because I'm still not making enough virus potentially. And that risk of a false negative decreases every day after the day I get infected. And it minimizes somewhere in that 5 to 10 day window after exposure, but it's still like 20%. So there's still a 1 in 5 chance that even if I'm actually infected and asymptomatic, that a single test will be falsely negative. And that's why we don't use a single test to tell people they can get out of quarantine because you could still be infected and just have a negative test. But if you're going to get tested, which I advise, do it in that 5 to 10 day window after exposure, because if it's positive, that's a game changer. That's really, really helpful. If it's negative, just continue to quarantine until your 14 days are up. Jay, does that help clarify that?
Yes, thank you. Thank you for that.
Sure.
Jay, this is Bob Black. I was wondering if we can get some clarity on, are you shredding the virus during that whole period of time that you're, the whole 14 days while you're infected? And again, what other contact points should you be careful of when it comes to the transmission of the disease?
Yeah, so a couple things to note. One is, if someone is diagnosed with the infection, particularly if they're symptomatic, if they're not hospitalized because of COVID and they're not really immunosuppressed or immunocompromised, but they're just regular folk who get COVID-19, they're having symptoms, they're not in the hospital and they get diagnosed, they're considered to be contagious for 10 days following the beginning of symptoms, assuming that by day 10, their symptoms are getting a lot better and they're not having any fever. And that's been shown that type of person stops shedding infectious virus by about 9 days at maximum following the onset of symptoms. But they could still test positive for weeks afterwards using a very sensitive molecular test for the viral RNA, which can still be detected even though they're not shedding contagious virus. Now, if somebody is a close contact, we don't actually know if they're infected or not. But what we know is that if they did get infected at the time of that close contact, it could take anywhere from 2 days to 14 days for symptoms to begin. Now, if they're one of those people who gets infected and never develops symptoms, they may get detected as a case when they go in for testing, asymptomatic testing. And if that's the case, we would say that they are contagious for 10 days beyond that test being positive. It's a little bit arbitrary because we don't know exactly when they started shedding virus, but they're considered to be contagious for an additional 10 days. And for contact tracing purposes, we consider close contacts to be the 2 days leading up to when their test was done. Because we know for people with symptoms that for 2 days leading up to when they get symptoms, they're shedding virus. So if a close contact doesn't get tested or they test negative and they're not having symptoms, we don't consider them to be contagious. We're just being careful, keeping them quarantined. But if they were to develop symptoms, let's say on day 13 of quarantine, we would say, and then they get tested and that test turns out to be positive, same rules apply. You're now contagious for 10 days beyond that day your symptoms started. And close contacts would be 2 days before symptoms and after while you're contagious, that next 10 days. But hopefully if they were quarantining, there aren't close contacts from 2 days before. Thank you for that question. Yeah.
A couple quick comments. We're getting a lot of feedback on great questions, great feedback. I am going to ask some of the questions that are coming across are really specific to your business or specific to Wilson County. I'm going to direct you back to the CDC's website as well as the Tennessee Department of Health websites for exactly the guidelines that you should follow for either for your workplace or for your household. I think our message today really is we need you to follow those guidelines, and they're a little bit different for each scenario. And so we'd like for you to reach out to those resources directly for the guidelines. But the single most important thing is wear a mask and spread out. And that's the message that we want to preach today, because we know that will limit the spread of this virus. One question we got about staffing here at the hospital. I want to be clear, we have contingency plans and have created additional capacity here as well as at BMC and are prepared to take more patients. However, I'm going to say again, the trend is concerning, which is why we're having this call, because the more patients that come down with COVID, the more difficult it becomes for us to take care of patients. And so we're asking for your help so that we're not pushing the system to the brink and to the limits. And we've got a ways to go before we get there, but we want you to help us in preventing us to getting too far down that line. This is a stressful disease. We've got great teams and great nurses, but the system is already taxed, and we're just asking for your help down the road. So one question is about officials enforcing the mask mandate. First, let me say I support Mayor Randall Hutto's masking mandate that has been in effect as of the end of October. It was reinstated. Mayor Hutto is in a very difficult position. We appreciate his leadership during this time, and I think he's taken the correct approach by asking people to do the right thing and follow the mandate that's been put in place. I think as far as enforcement is concerned, I don't think the sheriff's department or the police department should be out putting people in jail for not wearing a mask. I don't think that's what this is about. But we do think that people should be responsible and encourage each other and model good behavior by putting a mask on in your community. And that's effectively what we're asking for today. Let me get through some of this chat here for a second, just see if there's anything we haven't covered. Jeff Peterson, looked like you had 2 questions. I don't know if they're reflected in the chat or not.
Hey, those are my questions. The quarantines are problematic for businesses, and we get asked a lot of questions about that in business. When is a person in contact? The CDC website, we've looked at that a little bit, and I just wondered if the doctor would reaffirm what that says about what is considered contact with a person who's infected, so we understand that. It seemed to say you're within 6 feet of somebody for 15 minutes. That's contact, and you better quarantine, get tested. And as you know, once you are going in to get tested with good reason, they're going to tell you to quarantine until you get your test results. So test results are coming 2 to 5 days. Sometimes we've had them be 7 days after testing. I hope that's improving, but it's a burden that we need to undertake. If there's any question, we should definitely do it and follow the quarantine, because we don't want this to spread. At the same time, we want to avoid panic. Just that, I saw somebody, I said hi, I was 10 feet away from them. Am I going to quarantine now?
Yeah. First of all, thanks for your question. This is a very common question we get a lot, particularly from businesses. So the CDC guidance is close contact of a case is when somebody has had a cumulative exposure to that case within 6 feet of 15 minutes over 24 hours. So for example, if I spend 5 minutes less than 6 feet away from someone who turned out to be infected that day, and I do that 3 times during that 24-hour period, that's considered a close contact. And every built environment is a little bit different. You do want to take into account proximity, crowdedness, whether the person was symptomatic or not symptomatic. There is some nuance to saying, you know what, it wasn't exactly 15 minutes, but I'm worried because this interaction was in a pretty closed space with no masks and someone was symptomatic. So it's not written absolutely in stone, but remember, if somebody does meet those criteria for being a close contact, they then need to quarantine at home away from others for 14 days, awaiting the arrival of symptoms, which hopefully never arrive. They should get tested between 5 and 10 days after that exposure. A positive test is very helpful. First of all, that tells them that they now are considered contagious for the 2 days before that test and the 10 days following that test. And they're now a case, not a contact. So that's important. A negative test, while helpful with a lowercase h, is not as helpful as a positive test. What I mean by a lowercase h for helpful is that a negative test, a single negative test, doesn't get someone out of quarantine. It doesn't bring them back to work. It just means we were unable to identify you as a case. So keep doing your quarantine. So if it takes 2 to 5 days to come back, they may not find out that they were a case for several days, which puts everybody on their heels. But a negative test doesn't mean, oh, I could have gotten out of quarantine 2 days earlier or 5 days earlier. Thank you for that question.
Thank you for that explanation.
What looks like one comment we have here is just about in-person meetings and gatherings. I can tell you that we strongly encourage you to do Zoom or telephone conferences. Here at the hospital for many, many months now since this began, we have not been having in-person meetings. I've got folks in my administrative suite that we're Zooming next door because we're trying to limit as much interaction as possible. So we would encourage you to do the same to the extent that you can. And that will go a long way to help preventing the spread of this virus. We're right up on 30 minutes. I'm going to stop and see if there's any additional questions. We certainly don't want to take your whole hour, but I want to stop and see if there's any final questions or comments.
I had one more question if nobody else does, and that was about air travel, because we keep hearing air travel is safe, and I hear now that Southwest is even packing the middle seat. So I've heard horror stories of people on fully loaded planes, and you're sitting right next to a person for 2 hours, perhaps, could be longer. Is the airflow and the HEPA filters on the planes that good that that's still something you'd have no trepidation about undertaking long flights? Or are we starting to rethink whether or not that's recommended?
Yeah, thank you for asking that. You know, we have been paying close attention to that. I think, first of all, given how active COVID-19 is in the United States, that I would abide by the CDC guidance, which just came out that essentially said leisure travel is not recommended right now, given how active disease is. Now, that being said, yes, airlines and airports and airplanes are doing a lot to try to reduce risk. That risk can't be eliminated. People without symptoms can be infected, as I discussed, and they can get on airplanes and they could potentially transmit the virus to others. So we need to remember that. But by doing symptom screening, by requiring, some airlines are requiring tests to be done, some states are requiring tests to be done, by wearing face coverings the entire flight when possible, or if you have to take a drink or eat or drink, just pulling your mask down to do that, putting it back up, are all helpful. For sure, airlines, you know, each airplane exchanges its entire air every 2 to 4 minutes, and they do use these really good HEPA filters. So the air quality generally is pretty high, but there, you can't eliminate the chance that there could be a transmission event. We've heard some news recently about a transmission event that occurred on a plane coming to New Zealand. That was an 18-hour flight, I might add, but there were 4 or 5 people on that flight who seemed to have gotten infected on that flight. So, you know, airplanes themselves are, all things considered, safer than if you were to create a room in a building that was exactly the shape of an inside of an airplane with seating exactly the same. That would be less safe because there isn't the sophisticated air exchange and filtering that's going on. But I really think right now, with disease activity as high as it is, it remains a risk taking any kind of public transportation for a prolonged period of time.
Okay, we've got maybe time for one more question. If somebody wants to ask a question, then we'll give you your afternoon back. Okay, well, let me just wrap it up then. Again, you know, we hope that you'll educate your families and your employees about this issue, and we're trying to create awareness that the trend is going up. So we hope that we've accomplished that today. And then secondly, please wear a mask. Please keep yourself safe, keep your family safe. And we're asking as a hospital for you to do that, to continue to keep our community safe. So I'm gonna leave it at that. I'm gonna say thank you again for everybody's participation today. There's a lot going on, we know, and it's a stressful time for everybody, given the impact this has had on our community and our country. And I want to thank everybody for doing your part to continue to help us get through this. So with that, I'm going to sign off and say thanks again. Have a great day.